The health secretariats of São Paulo and Rio de Janeiro recently revealed community transmission of the coronavirus Delta variant in the two major Brazilian cities. The Brazilian Ministry of Health acknowledges 27 confirmed cases of the variety that originated in India, with 5 deaths. Tedros Adhanom, the WHO's president, said last week that the globe is reaching a critical stage in this pandemic. Transmission of the Delta form has reached at least 104 nations, with epidemiological curves exploding in dozens of countries. Brazil surpassed 540,000 COVID-19 deaths and continues to be the world's deadliest day. COVID-19 kills 1,244 individuals in Brazil every day while infecting 42,819, according to Worldometer data. The high percentage of positivity implies an extensive circulation of the virus. According to the Fiocruz COVID-19 Observatory, the current drop in rates is due to an increase in vaccination of the Brazilian population, which is still in its infancy, with just 15 fully inoculated. The available vaccines have limits in relation to blocking the transmission of the virus, which continues to circulate with intensity, the researchers warn, adding that the possibility of the emergence of variants with potential to reduce the effectiveness of available vaccines is pertinent and cannot be overlooked. They conclude by urging people to maintain social distance, wear masks, and attend vaccination campaigns. In contrast to the policies being promoted by all parties of the Brazilian ruling class, these guidelines encourage people to believe that the pandemic is gone. According to the survey, 53% of Brazilians feel the epidemic is partially controlled, 5% believe it is entirely controlled, and 41% say it is out of control. In March, 79% said the pandemic was out of hand. Brazil's COVID-19 numbers have fallen, according to an editorial in the Estado de São Paulo published on Friday. That government continue vaccinations as soon as possible, and that personal care is still strictly necessary, are its only advice. These bourgeois channels strive to depict the similarly criminal activities of local politicians as responsible policies while isolating the growing opposition of the Brazilian public to the homicidal capitalist reaction to the COVID-19 outbreak. Governor João Doria of the Brazilian Social Democracy Party, PSDB, advocates a mass attack on coronavirus control measures, despite their catastrophic repercussions. COVID-19 has already claimed 133. According to data from the APEOESP Union, this strategy has resulted in at least 1,194 outbreaks in school buildings and the deaths of 100 instructors and 3 children. Doria announced last week a flexibility package that includes, among other things, the reintroduction of in-person classes in colleges and the lifting of the student restriction in school classrooms. The 1.5 meter minimum was likewise reduced to 1 meter. On Wednesday, he demanded the return of all state employees permitted to work from home because they were in so-called high-risk groups. It is back to normal, and we are confident, he said, justifying his brutality. Doria said he was infected with COVID-19 a second time, despite being properly inoculated. As the result of his own illegal policies, he is unable to declare that life is back to normal. Governors in every state in Brazil follow Doria's lead. Rio de Janeiro has also reduced classroom distances to 1 meter, aiming for a quick return of children. Local teachers voted overwhelmingly last week to go on strike in protest of pro-capitalist Governor Romu Zima's reopening of state schools. Rui Costa, governor of Bahia's Workers' Party, PT, announced the restoration of in-person sessions later this month. When confronted with teachers' refusal to return to work, Costa publicly threatened them, saying, "If you miss work days in a row without reason, you will be dismissed." The unchecked spread of the COVID-19 virus in Brazil and around the world exposes capitalism's and politicians' unwillingness to address humanity's most basic needs. The working class must be mobilized as an independent political force in order to put a stop to the pandemic. Increasing strikes and large protests in Brazil against the ruling elite's homicidal policies are paving the way for this revolutionary approach.